Richard Lewanczuk, the Senior Medical Director for Health System Integration for Alberta Health Services. Loneliness and social isolation have a huge impact on our physical health, and we now understand the biology behind it. To us, loneliness and social isolation is just another form of stress. So mental stress is the same as physical stress. And when we're under stress, our bodies release a whole number of hormones, way more than the classical ones that people learn in high school biology, which tend to have adverse effects. The body starts to prepare itself for something going wrong. So it activates the immune system, which spills over and can affect the joints and the blood vessels and the organs in an inflammatory sort of way. Studies have been done for people who have been put in solitary confinement. So they've taken volunteers and they've isolated them for a month, and then they've looked at what's changed in their biology. And there's changes in the genetics, there's changes in what we call the epigenetics, so the things that control gene expression, changes in the hormones as a result of that solitary confinement. The really scary thing, though, is they brought these people back 6 months later and they still found these same changes persisted. So we talk about prisoners and solitary confinement and the inhumanity of that, but in a way it's no different than somebody who's alone, socially isolated, lonely in their apartment down the street. We once did a study with school-age children, thanks to Black Gold School District, where we followed them for a period of 7 years, and we could actually determine and predict at about age 5 or 6 when a child would develop their type 2 diabetes, for example, just because we could look at their physical activity, their weight, and say that if nothing changes, if the trajectory remains the same, this is when they're going to develop diabetes. Our healthcare system right now picks up on them when they develop the diabetes, but we could have predicted it 20 years earlier and intervened earlier. So I think really, really important that we understand the role of social factors in our communities in determining our health.